MMT, knee flexion, biceps femoris, semitendinosus, and semimembranosus. Assist the patient to the prone position with the legs straight and the toes hanging over the edge. The test may be started in about 45 degrees of knee flexion. Standing next to the leg to be tested. Passively move the patient's knee through flexion. You're not assessing the infield, you're determining how much range the patient is able to move in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to flex the knee to 90 degrees as you observe for any substitutions. Stabilize the patient at the pelvis. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include the following. The buttock on the test side will rise as the patient attempts to flex the hip. The sartorius may try to assist with knee flexion, but this also causes flexion and external rotation of the hip. External rotation of the hip to decrease the resistance of gravity. Strongly dorsiflexing in an attempt to use the tenodesis effect of the gastrocnemius. Watch for internal or external rotation of the hip during knee flexion. This may indicate a stronger semitendinosus or semimembranosus or a stronger biceps femoris, respectively. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient at the pelvis or proximal femur if necessary. With the other hand contoured over the posterior aspect of the leg just proximal to the ankle, apply resistance in the direction of knee extension. Grade 5, normal. The knee flexed to available range of motion and the patient was able to hold the end position approximately 90 degrees of knee flexion against maximal resistance with no break in the position. Apply the force for a 5-second count. Grade 4, good. Knee flexed to the available range of motion and the patient was able to hold against strong to moderate resistance. Grade 3, fair. The patient is able to move through all the available range of motion in knee flexion, but is unable to tolerate any resistance. If none of these conditions are met, we must reposition the patient in a gravity-eliminated position. Assist the patient into the side-lying position with the test limb on top. The lowermost leg can be flexed for stability. The gravity-eliminated position of the therapist is to stand behind the patient at knee level. Support the test leg by cradling the thigh, providing hand support at the medial side of the knee. The other hand supports the leg just proximal to the medial malleolus. Observe the patient and hip for any extraneous movements. Ask the patient to flex the knee. Grade 2, poor. The patient completes full range of motion in the side-lying position. If this condition is not met, then you must reposition the patient to test for a grade 1 or 0. Assist the patient to the prone position. Make sure the legs are straight with the toes extending over the end of the table. The therapist's position for grade 1 and 0 is to stand next to the test leg at the knee level. Support the flexed limb at the ankle with one hand. With your other hand, palpate both the medial and lateral hamstring tendons just above the posterior knee. Ask the patient to attempt to flex the knee. Grade 1, trace. There is partial range of motion or you are able to palpate a contraction at the tendons. Grade 0, no palpable contraction.